Welcome to the Festival of the Mind 2020. My name is Dr. Matthew Lariviere, a researcher from the Center for International Research on Care, Labor, and Equalities based at the University of Sheffield. I'm delighted to introduce my project, Sheffield Carescapes, Potential Futures for a Caring Society today. I want you to bear with us if you're based in Sheffield today. It's a bit gusty outside. You may be getting a bit of wind feedback from us today. Sheffield Carescapes is an exhibition that asks us, what could the future of care look like? It features illustrations from Rob Richardson and Kate Morgan, pictured there on the right, and short stories written by Akeem Balagan. The exhibition is currently on display at the Millennium Gallery here in Sheffield, as well as online as part of the Digital Futurecade. As an exclusive online feature, Akeem's short stories are available as PDFs and as a fully voice-acted audio recordings. I highly recommend you check those out. This talk today, though, provides the behind-the-scenes glimpses about the research that informed the illustrations and stories. We'll talk about what inspired the production of the exhibition, as well as commentary on the illustrations and stories. If you examine any newspaper nowadays, you'll see frequent mention of the state of care in this country. It's often framed as being in crisis or at the tipping point, as shown here with the Age You Case campaign a couple years ago. Adult social care in this country suffers from high staff turnover rates, financial insecurity after a decade of austerity cuts. The care workforce is considered low-skilled, resulting in an undervalued profession working in low-paid jobs. There's often no clear career progression for care workers, unlike their colleagues in nursing or in other allied health professions. Families also have a crucial role in supporting people with additional care needs. These carers, however, as we call them, also need support themselves to fulfill these obligations and these roles. In my research, I have focused largely on how technology can support the policy goal to age in place, as we call it. In other words, what that really means is how can technology support people, predominantly older people, to live in their own homes and engage with their communities for as long as possible, until their death or hopefully delaying moves into permanent residential care. This has included multiple projects over the last 7 years, including my PhD study about how assistive technology can support people with dementia, and also including my current study, which is looking at how emergent technologies like robotics, artificial intelligence, and apps can support aging societies here in the UK, but also abroad. Pictured here is Miro, which is designed by Consequential Robotics, which is a spin-off from the University of Sheffield, so local grown. This robot is unique and it's designed to mimic animal-like behaviors as opposed to human ones, which is crucially important because a lot of times there can be what we call an uncanny valley in the development of robots, where things become too human-like and it becomes a bit creepy and unnerving. So by focusing on a social robot which is for people, make them feel less isolated and connected, that's much more animal-like instead. Within health and care as well, we're seeing a massive increase on everyday consumer technologies as well. The Augmented Consortium, which is based in London, has trialed personal assistant devices like Alexa in areas of Hampshire and the London borough of Barnet. We're seeing an increasing number of smart technologies that allow us to connect different appliances and devices, like our tablets and our mobile phones, to different appliances within our homes and other built environments. There's also a massive surge in development of new apps for both supporting different health outcomes or overall well-being. And that's also on the rise. Now, as a researcher, what I try to look at is I look at the patterns of these emerging kind of cases, right? The different technologies, and try to think about what kind of theories, what generalizations can we make about that. And one thing I always come back to as a social scientist is, what do we mean when we say care? What does care mean? Crucially for us, when we think about care, it's combined with another noun. So it's social care, it's health care, child care, or even veterinary care. But care is about supporting individuals, whether humans, animals, or even the environment. But it comes down to a few essential characteristics. Based on my research, care is about 4 components. So care is interactive. We provide care, right? We are doing something with another person. We care about their feelings. There's always one person doing something else to another person in a caring situation. And because it's about two individuals at least, care, therefore, is also about relationships. Now, these could be familiar relationships, such as a parent and a child, or perhaps spouses looking after each other too. However, it could also be clients or patients, members of a caregiving profession, whether in social care, housing, or in health services. The qualities of these relationships will shape the expectations and practice we do for caring. Family members will want to do certain caring things, maybe feel uncomfortable doing other ones as well, and professionals likewise. And with that aspect of caring, there's a kind of physicality to it. Care workers may be making a meal, a parent may be bathing a child, or might just be giving a comforting embrace to a friend. There's a material, kind of tangible quality to care. It's often facilitated by being in the same place as a person, right? Occupying that same kind of built environment, whether it's a home or a care facility or a ward in a hospital. There's always that kind of material component to it too. And the final element I'm going to talk about is emotions. So care is often focused on ideas about empathy and love. But conversely, because care obligations can be tied to family and professional things, caring can also be angering, frustrating, annoying at times too, but often there's an emotional capacity to it as well. And obviously what we hope we can do is make caring a much more pleasant experience for all involved. So, what could the future of care look like? I've highlighted the current challenges for health and care systems, actually combined with this new focus on technology we're seeing a lot in the UK, but also abroad as well. So in my research, I want to explore how the future of care could look and feel if we so-called got it right. So what if we designed new technology that supported people to live as they wished? What if we invested in the care workforce with tangible benefits, such as better wages and an actual career pathway? What if we focused on mutual support for all members of society as a marker of progress rather than things like GDP or another kind of econometric measurement? It is these questions through my research that prompted me to reach out to the public engagement team at the University of Sheffield, who put me in contact with Akeem, Rob, and Kate to help create Sheffield Carescapes. Now what I'm going to talk about for the rest of the talk is kind of a illustration by illustration, story by story kind of overview of what we're trying to depict or evoke in the individual illustration or piece, and also kind of the commentary tied to it as well, like why this, why now, and the kind of questions we're trying to pose to you, the public, to think about the futures of care. And one reason why I want to do this, because like art, research, especially social science research, is about storytelling. In order to imagine a future of care, or potential many different futures of care, we need to have language and depictions that can stir us and motivate us to think about how this could change in our lifetimes. So this first picture here is by Kate Morgan. She actually will do the first 5 illustrations here. In this image, you'll see digital technology, like Amazon's Alexa and smartphones are increasingly common in our everyday lives. So in the not too distant future, digital technology may provide a greater role to play in care and support for people at home. Maybe using robotic helping hands, which you can just see there in the kitchen off to the left, these little hands dangling down. Family carers and care workers may also use technology to hold regular virtual meetings with a family member or clients to check their vitals and their well-being, which I think we're seeing increasingly more common now, especially with the current COVID-19 pandemic we're all living through. Such technology may help individuals feel socially connected with their family, communities, and also the care practices they require to sustain their own well-being. And also, crucially, it will help them stay at home and within their own communities for as long as possible, too. Again, it's that aging in place kind of goal where we all want to live in our own homes for as long as possible. Now, many health and digital care technologies rely on people using phone lines to connect people with care professionals. In the near future, digital technology may provide alternative means for people to connect with each other. Maybe two-way cameras can allow people to maintain contact over vast distances. And again, it's something we're seeing increasingly common now as a result of COVID-19, where we can't be in the same physical spaces as another individual we care for. How can we still connect with them? And oftentimes it's through kind of information communication technologies, like our mobile phones, our smartphones, using Skype, Zoom, whatever kind of platform or system in mind. But it's through these technologies we can kind of do that. So what if it became more prevalent in health and care systems too? What if care professionals could use digital technology to monitor vital statistics such as blood glucose levels or blood pressure, and potentially use that to identify new illnesses or changes in a person's health requiring immediate intervention, but also to prevent potentially illnesses from arising as well? If we can kind of anticipate high blood pressure leading to kind of coronary or another kind of heart-related disease, how could that help us? So with this, we want to ask people, would you want to be monitored in this way? I think it's a very important question. We're designing a lot of new technology, but is there appetite from the public to want to be using these technologies? What do you see as the challenges and opportunities for this very novel approach? And as I kind of mentioned earlier in the background to this presentation, our current social care system focuses on delivering services, right? But it's all divided by what we call time and task. So care workers may have a specified amount of time to go into a person's home, maybe 15, 30 minutes, to do whatever they can, often preparing a meal, bathing, or helping with other personal care, or making sure a person takes their medication when they're supposed to. It's all about routine tasks. However, this model of care does not always center on what matters most to an individual, right? It's based on what a system thinks is most crucial to help them at that point in time. But for a person who may be quite relatively independent in some ways, they might be able to do some of those things themselves, or have a family member or neighbor who can help them do those things. And actually, for them, the most meaningful thing could be having social connection, having a person to talk to, slow down, take time out of their day to ensure that, just having a conversation. So with technology in place to monitor people remotely, families and carers might be able to sit down and actually have meaningful social time just to have a conversation, catch up, have a cup of tea. With this illustration, what we wanted to see is, what would you like to have? What are instrumental tasks or really things that are really important to you that you would want to ensure was be able to be met by social services or other kind of health professionals or public services? And what is important to you that you would want to make sure that you have some sort of social connection as well? So what's kind of the line of best fit between those two things? How do we negotiate in those? For the next illustration, some of you may be aware of, in the Netherlands, they developed this village-like environment called De Hogewijk, which is a purpose-built environment basically meant to be a simulated village for people living with dementia. In this village, people with dementia can access local shops, go to the hairdressers, and any other kind of stores you might expect to have in a small village. The exceptional quality about De Hogewijk is that each of the person occupying one of those kind of service positions is a care professional or social worker in their own right. So that if a person with dementia were to become confused or agitated, or just they would have someone there who could look out for them and help orientate them or get them back to their dwelling. As a critical social scientist person, I would say that, on the other hand, this has the consequence of isolating people with dementia from society. It excludes them from society by giving them kind of their own little constructed mini society for them to occupy, but doesn't allow them to engage with their communities, dwellings, families, relationships perhaps they have outside of that little village that they've created for that. So the question is, what would happen if we, in the UK or elsewhere around the world, recreate a town separate from real life? Would it be a space for the elderly, or people with dementia in this case, to move through life at their own pace, or would it isolate them further? Could life slow down for us all, perhaps, to help accommodate that? And could town planning be tailored to help us all moving into later life, and perhaps the frailty that may come along with that later on too? And this final piece by Kate, we're seeing increased emphasis now in health and social care about supporting people in their own homes, as I mentioned, right? That's the policy goal. It's what we all want as well as individuals. Since the 1980s, there's been an increasing role to have people receive care in the community. More recently, we've seen GPs doing social prescribing to help support that as well. However, such support requires individuals, often the carer or their family, to navigate multiple complex systems. So it's not just the National Health Services, and specialist services within there, as well as primary care. It can also be social care, transportation, housing, which can be a lot to do if you're unfamiliar with these systems or being introduced to them for the first time. Some local authorities and NHS trusts have experimented with the role of a care navigator, which is a person specifically to help individuals navigate in these systems. In Somerset, they've been working on a person helping with that in primary care called the FRO model of enhanced primary care, with health navigators as well. So I guess one of the questions we want to pose here is, could that system work for you? How would you like to see the systems organized? We all know that the health service is meant to be more increasingly person-centered. What does person-centeredness mean to you as we think about futures of caring as well? And how can we do it better? Now, one thing I really loved about working with Rob and Kate when it came to the illustrations is the different aesthetic each of them brought to the team. I think Kate's work is very playful, colorful, and it feels very kind of comfortable. Now, what I like about Rob's work, which I'll show you the first one now, is that it really kind of brings to a kind of graphic novel, almost like mid-20th century kind of pulpy magazine kind of aesthetic to it. I think it's a good way to kind of think about the more science fiction, slightly dystopian, but hopefully thinking about how we can prevent these from happening too, or even subverting our expectations as well. So for instance, with this illustration here that Rob did, it's a kind of play on our cultural perception and imaginary about robots as harbingers of doom, right? We have things like Terminator, we've seen Battlestar Galactica, pretty much any sci-fi production, it's all about robots are going to kill us sooner or later. Yet many in health and care believe that robots offer a lot of potential for transforming the lives of individuals, but also our care systems. So in the future, robots could play a role in helping support people in their own homes and communities. I guess one of the questions we want to ask with this illustration is, doesn't matter what these robots look like. What do you think about the robot depicted in this image? Would you want this robot to provide care for a person you loved? And what we really were trying to do with this illustration here is, it is a menacing, insect-like looking robot. But if you see in the foreground there, it's making a sandwich for the person to the left. So is that enough? Is it okay having robots like that, which may be required to have the kind of capacity and kind of engineering to support doing kind of complex tasks, but also make it perhaps look not quite as threatening to us as well? For Rob's next illustration, we wanted to look at the potential of augmented and virtual reality and how that might allow us to perceive different environments we're interacting with, right? So as we become frailer due to disability or aging later in our lives, we may no longer be able to participate in the leisure and recreational activities we once used to take part in. So in the case of this illustration here, there is a woman experiencing scuba diving through an augmented reality program and a headset there. I think it's a really interesting idea about how we can still engage in our lives with things we used to like to do and still relive those in some way, even if it is a simulated reality of that. So could augmented or virtual reality provide an immersive and positive experience for people as we become less mobile or less active in our everyday lives? What kind of experiences would you, as a public, want to maintain with this kind of technology? And what would you insist upon being stuck in, the lived material reality we all share together? Apologize again for the gustiness right now. This next illustration is meant to kind of think critically about the idea of aging in place and aging at home. As I said, it is the policy practice goal. We all want to live in our own homes for as long as possible. But we can't forget that home and communities can also be locations of neglect, abuse, and deprivation. National policy can be implemented unequally. Resources can be distributed unfairly and disproportionately. How can we make homely living spaces within these unwelcoming environments. And that's something we would like to kind of pose to you as a public. What would you like your home environment to look and feel like, even if we become increasingly a more deprived or urban kind of environment sort of thing? How can we make those lively, warm locations to enjoy? Again, think about COVID-19 pandemic, what we're all living through. Many of us have been required to keep physically distant from our families and friends, even at the point when they have become ill and passed away. Many people have relied instead on digital technology to maintain some form of contact during this period. As physical distancing may exist to some extent for the foreseeable future, how can we sustain our relationships through this kind of technology-mediated relationships? How can we maintain that sense of feeling connected to our friends, family, community, fellow citizenships around this country, in these divisive times as well, when we are physically kept apart from each other due to public health guidelines? How important is virtual interaction when socializing is limited? How can we ensure virtual interactions do not exclude the most vulnerable in society, who may not have access to technologies or the infrastructure like having broadband in some rural remote areas of this country, to make sure they still maintain connected and don't actually become more isolated as a result of this public health crisis? And now this final illustration from Rob is thinking about housing options now, but also into the future too. There's not enough housing stock for all of us, and what does exist is not always well adapted to people with different abilities, whether it's due to mobility issues or other issues within their own home or their own lives. As I mentioned before, with the De Hogewijk case in the Netherlands, people are thinking about developing new kind of retirement villages or communities based upon, in that case, this particular illness. But what if we took that kind of same concept about shared characteristics and applied it to perhaps people's actual real interests, right? So what if we had a retirement community for retired rock musicians or footballers, right? How could that look and feel for individuals? In this case, this is an example Rod did with people who have been punks all their life. Now they want to get together and still live in kind of a punk commune. How can we support that kind of individuality and that choice to kind of come together as a community in that way instead? Now that comes to the end of the illustrations bit. So now I'm going to move on to the bit on Akeem's stories, which are comprehensive and assistive robotic enhancer and how many years. Now Akeem came up with these ideas for these stories following a department seminar I did in January. And we had some really lovely chats at a nice neighborhood on Glossop Road before the first lockdown, so in the before times that we're all living in now. And in these stories, you really want to emphasize the human-centeredness of care, right? So how humans are at the kind of nexus, the very center of everything we do for caregiving. It's the importance of relationships and then challenges and opportunities afforded by new technology in the near-distant future. Now, I will not spoil any stories right now for you. I hope that you will check them out online. You can read them as a PDF or, again, read the audio recordings. I listen to the audio recordings. They are phenomenally voice-acted and a real boon, I think, to this festival. So, in closing, I want to thank the University of Sheffield, Public Engagement Team, the Economic and Social Research Council, who funds my work I do in my day job, and also thank Akeem, Rob, Kate, for all their hard work in creating this exhibition with me. And again, I think it's just important for us to pause and reflect on what kind of future we want to live. And I'm hoping that by giving you just some artistic depictions of what that could look like, it spurs your own curiosity to think about what kind of future you want for yourself, your parents, children, and any other future generations in the future. Thank you. I'll now take questions on the live chat. Right, so question number one from the live chat is, how effective are the animal-like robots in improving the well-being of people in care settings? That is an excellent question, and I will say that this is an ongoing development for this robot. It was originally designed as a research tool, It's now being tested out in educations and residential care settings. It's an ongoing evaluation to see how effective that will be. We have examples of other robots like Pero the seal, perhaps many of you have seen, which is believed to have some effect on helping people feel calm, reassured, especially people with dementia living in residential care homes or nursing homes. But it's still very early to see about how effective that will be for the long term. Question 2, what kind of issues of affordability do you anticipate in regard to how access to these technologies is made available? I think that's a crucial question to ask, and actually, it's something that I grapple with a lot in my own research. There's been a lot of emphasis, as I said, on robotics, smart home technologies, and there are many barriers to that. One is potential cost. It's cost millions of pounds to develop some of these robots. So for a return of investment for these businesses developing them, they need to have a relatively steep price point, at least initially, until things become developed further, refined, and parts become cheaper and labor becomes cheaper too. Likewise with other technologies too, like smart home devices. If you don't have access to broadband because it's not available in your area, or you can't afford it for whatever reason, then you lose out on a lot of these digital technologies we're all focusing on right now. So there is a clear warning there that although we want these to support health and care outcomes, by the unequal access to them, we may be creating additional health inequalities in society too. I think that's something for us to be very wary about if we focus too much on technology, which is one reason why I think we need to focus on not just how technologies can support us, but also how we can support the workforce to want to stay in job and have an actual career there. That's a crucial role people will play. And also how to support families as well, who do a lot of this unpaid, invisible work behind the scenes at home to make sure they are having a fulfilling, caring relationship too. Right, the next question. Can you tell us a bit more about the collaboration process? Did you share research data or policy papers with the artists? So I share some policy briefs with the artists, as well as I mentioned, I did a department seminar which Akeem was able to attend earlier this year. And in that I shared some of the data, which my data is primarily what we call qualitative research. So again, it is like the artist and like Akeem in some ways, and that it is about storytelling, right? So it's about looking at cases of caring and kind of looking at the patterns across cases to understand kind of more generalizable ideas about what care is about. Or in this case, my research predominantly about how technology may or may not support people. So I did share some there. And unfortunately, as we got the funding approved, I believe, in March, we were only able to meet a couple of times as a full team face-to-face. And then, of course, we were all doing most of the collaboration over Zoom or Skype or at our own homes. So the collaboration is very much about sharing ideas over email, over video chat, sharing draft illustrations, Akeem sharing drafts of his stories, me giving feedback on it too, to make sure that it feels rooted in the realities of care as it is now, but also aspirational for how care might be, and giving them that artistic kind of opportunity to think creatively about how it might be too, based on their own experiences as well. Question 4. I've come across U.S. academic projects on ethics, technology, and policymaking. How do we implement less threatening technology in the real world? By real world, they mean community housing, dementia patients and households. My experience working with clinical populations is that they are supremely resistant to even basic tech, even WhatsApp calls. Well, I think that actually highlights a good thing too, is that is it ethical to push technology on individuals if they are resistant to it? And I would say that no, honestly. Sorry with the wind. What we need to think about is having different methods or means of people acquiring the services they need. If people do not have access to digital products, access to the internet, we can expect them to sign up for a GP consultation online. We need to have alternative systems. Ideally, systems they're already familiar with. They may not be familiar with a WhatsApp call. Some people may know how to text, though, just using kind of standard SMS charges. Or they might know how to just use a normal phone call. We need to have multiple pathways available for people to access the services they need. And pushing specific technologies on people when it is undesirable to them or does not fit into how they want to live their lives does not make sense. The caveat is that aging is a process, right? We are all aging. So whatever technologies we're developing right now, if they're not fit for purpose for people who have have specific conditions right now, maybe in their late 80s or 90s, it may work for people who are in the baby boomer generation, who are coming of age now, or becoming pensioners too, who will have some digital skills as well, right? So digital literacy and aging are moving side by side, not always at the even rate. So I think it's a matter of thinking about designing technology for future people who will be older, sort of thing, but keep in mind that not everyone will have access to those devices and services. And we need to keep services that are working for people right now, like by post, like by telephone, available as means to accessing services too. Right, that's the end of questions. So I would just like to say then, thank you for tuning in to our event today. Please follow the Festival of the Mind website for more information about live stream events, exhibitions, and podcasts. Thank you very much.